Hi friends, welcome to Beats per Homeo. In this video, we are going to discuss gangrene and its homeopathic therapeutics. Please subscribe for support. What is meant by gangrene? Gangrene is the death of a portion of the body with putrefaction. What is meant by putrefaction? It is the fifth stage of the cell death. Putrefaction is the process of breakdown the cells. In the every case of the gangrene, there must be associated with the infection. The infection with the saprophytic bacteria. Majorly, gangrene has two types. One, dry gangrene, and second one is moist gangrene. Then how to differentiate between the dry gangrene and wet gangrene? What are the characteristic features that to differentiate between the dry gangrene and wet gangrene? If you observe this picture, the foot is affected by the gangrene. The characteristic feature in this, the color. The color changes from first it is a greenish color and then is changed to the blackish color due to the hemolysis of the red blood cell. Before this discoloration, where the part is affected, in that area the arterial blood supply is decreased. After this it appears as dry, shriveled and mummified foot in the dry gangrene. In dry gangrene, there is a bright red line of separation appears between the dead tissue means living tissue. The dead tissue in the green and blackish color with the living tissue. This dry gangrene is a diseased condition produced by the senile gangrene, diabetic gangrene and Buerger's disease and Raynaud's disease and sudden vascular occlusions like embolism, like injury to the vessels. Coming to the moist or wet gangrene, it is characterized by moist and oedematous limbs. For this wet gangrene, there is no fixed color. It may be vary among the dark red, green and purple and black. And the next one is it has horrible odor. This moist gangrene because of when the vein get obstructed, there is no arterial blood supply to that part. In that cases, so the liquefaction and the bacterial infection occurs at that. When the blood get obstructed, the hemoglobin is break down through a process of hemolysis, where the bacteria by putrefacting bacteria is saprophytic putrefying bacteria releases the sulfurated hydrogen. This is the most important point in the moist gangrene, sulfurated hydrogen. In the sulfur, the homeopathic medicine is well indicated in the wet gangrene. And the next point is there is no high zone of demarcation. The condition which affects the wet gangrene mainly due to the acute inflammation and long-standing venous thrombosis and the bed sores and the gas gangrene. Wet and gas gangrene has poor prognosis compared to the dry gangrene. Homeopathy can treat the gangrene. Though the body tissue that have dead cannot be revived, but the homeopathic treatment for the gangrene can stop its progression. For this, a detailed case taking and precise analysis of case to find the final prescription is needed. Cichalicoir is a top-ranked homeopathic remedy for gangrene, which is dry shrinked and with bluish appearance, with affected area is numb, and this key point is the skin feels cold to touch, yet the patient cannot tolerate the covering. If it is touched, he feels icy cold. In spite of feeling coldness, the warmth or external heat over the damaged party is unbearable. Covering of the affected area is intolerable. It is ameliorated with uncovering and cold. It is aggravated with external heat and covering. Although the skin is cold externally, but internally there is a burning sensation is felt. Arsenic album is also another homeopathic remedy for the gangrene. It well acts on when there is a burning feeling on the affected area, when the skin appears to be dry, dirty, blackish blue and shriveled, and because of the occluded blood supply. A very peculiar symptom for selecting arsenic album is if the patient gets relief with the warm application, even if there is burning, the patient requires arsenic album as opposite to the Cichalicoir remedy. And there is a cadaverous odor and the anxiety and restlessness in the patient. Carbovage. It is helpful homeopathic medicine for senile gangrene in toes. Carbovage is an important homeopathic medicine for senile gangrene of the toes. It is helpful for the gangrene in the aged people appearing as a insufficient blood supply due to the occlusion of arteries. The indicating feature of the use of the carbovage in the treatment for the senile gangrene is cold bluish skin. In some cases, a putrid odor for the gangrenous arises. Along with this, the person feels weak and lethargic and feels better in cold air. And another best remedy is laxis. It useful in the homeopathic remedy for the gangrene with the bluish, purple or blackish appearance. Laxis is a good homeopathic medicine for the gangrene. When it occurs in a malignant and septic dangerous state, it will work when the skin is bluish, purple or blackish appearance. The affected area is very extremely sensitive to touch. The skin may also have a dark blister or gangrenous ulcers. These ulcers are painful and having a burning sensation. Coming to the laxis is the hot flashes in various body. The parts may accompany with the skin complaints. Wearing the tight pants, especially around the neck and the waist, are intolerable for the patient. Thank you for watching. If you like this video, please subscribe and share and like it and comment.